All right, ready to thrive in 3 minutes for the oral commissures?
Yes, teach us how to thrive in 3 minutes when treating the oral commissure.
Okay, so national technology, I am using it to inject around the corner of the mouth. What I do is they use a 19 or 20 gauge needle, pilot about a centimeter lateral to the oral commissure.
Isn't that where the vessels run?
Well, I'm just in between, so it's about a centimeter and a half as a vessel. Good point.
Okay.
The superior and inferior labial artery will take off from the facial artery about a centimeter and a half.
Okay.
From there, so within a centimeter is usually where I'm at. Okay.
Okay.
And I go
right here. Perfect.
Yep, you can see that, and I go deep with a 22 gauge cannula, and I will often use a 70 millimeter cannula because sometimes I'll even go into the lip, and I will go below the muscle, just below the muscle.
The DLI and the DAO.
Yes, and the DLI, sometimes I'll go above it too. So I guess I go all around there. But the key here is taking that ligament, which is the labial-mandibular ligament, and I'm subsizing it.
Okay.
That's the key, is subsizing that ligament. If it gets too superficial, you'll get a strand there. But if you get just underneath it and you subsize it through multiple times, you can actually lay your strands across that labial-mandibular ligament, which is a false ligament. It doesn't go all the way down to the bone. And I'll put a little bit above the oral commissure, fill that in a little bit, and the whole corner of the mouth.
Now, how are you avoiding the inferior labial artery in this place? Because this is where it's running.
Inferior labial artery is deeper to me. I'm superficial to it.
Okay.
So I'm superficial to it. And also, I'm using a 22 gauge cannula. Granted, I know you can always get in with that, but it's very unlikely if you're using it the way I'm using it. It's very unlikely. I'm not near the artery's deeper to me.
So now you even work your way down to chin from this point.
And I'll go through the labial-mandibular ligament all the way down, sometimes even into the pre-jowl space.
Okay.
But the key here is a 22 gauge cannula.
Okay.
The key also is I like Nasha in this area, because if you use a bicross or a hyalocross, you sometimes get a little too fullness. I'll also use Express technology here as well because it moves with the mouth, so I really like it in this region too.
Okay. And so you did a study, didn't you?
Yes, I'm glad you asked. You do know what I write about, don't you?
I do. I pay attention.
You read what I write about. So we did a study this about 5 or 6 years ago, and we showed that if you put product around the corner of the mouth, raise the corner of the mouth, you can actually improve someone's first impression and you make them happier. It was the first study, I believe, to show that these treatments can improve someone's happiness. So yes, people feel happy. You're forcing a smile. You know when you smile, you're happy?
Well, look at her. I mean, definitely now you have a more horizontal orientation of the corner of her mouth instead of that downward.
You can see how it's going up there, right?
Yeah, because you've supported the depressors of the lip, which are all pretty much attaching to that lateral aspect of the inferior of the inferior vermilion body of the lip. Yeah. So I love it. And do you combine it with toxin?
Rarely. On occasion I'll put toxin into the DAO.
Yeah.
But I don't really do it that much, do you?
I do a lot. So I like to combine both. Gene Carruthers once showed that if you did a little bit of peri-oral toxin on the same day that you did lip filler, that you could actually have greater longevity of the filler in the lip. So I do like to relax the depressors of the mouth, specifically the DAO, and then even the platysma, because we know the platysma interdigitates with the DAO when I'm treating.
Where do you put the toxin?
I kind of draw an imaginary line kind of down that nasolabial fold or labial mental fold to the mandible, and I'll deposit about 4 units of onabotulinum toxin in that area, or 12 units of avobotulinum toxin in that area.
And you're careful for not to get
not go more medial and potentially get the DLI, because that can be really distressing for patients.
Yes, you can drop, and then people can get oral incompetency. That's not good.
So tell me now, here, when you treat the corners of the mouth, do you always treat the pre-gel sulcus?
No.
Okay.
It's separate.
So now you know.
Thriving in 3 oral commissures make people happy.
There you go. Who needs Prozac?
Thanks for watching, and please hit that like button.
And make sure to click on subscribe so that you can stay most up to date on all things thriving.
Like me?
You need to subscribe.